Good morning, everyone, and thank you for joining us here today. During the most recent election, our government ran on a promise that we would govern for all of us. We knew at the time that our promise for better health care, lower taxes, and safer communities would carry a price tag. And it was an investment we were and we are prepared to make. Even so, we understand that our government has an obligation to manage the province's finances responsibly. And here the challenge is real. In December, my colleague, the Minister of Finance, outlined the serious challenges that lie ahead in terms of the province's deficit. And while they aren't our numbers, it's caused us to pause and reflect on priorities, determining which ones are necessary to serve the people of the province, and where, in some cases, money allocated to projects can be reassigned to address more pressing needs. With clear eyes and a real roadmap, we developed our own plan that invests more on the things that matter most and less on frills and photo ops. That's why you will find no UK soccer club sponsorships in this plan. More importantly, it's why our plan will turn the page on projects that, whatever their value, just do not make sense given our current fiscal position. We started in December when we cancelled the request for proposals for a public-private partnership model for the twinning of two sections of the Trans-Canada Highway between Bishop Falls and Grand Falls, Windsor, and west of Whitburn. Instead, qualified companies will be invited to bid on separate contracts that will be awarded progressively, similar to other projects under the annual Provincial Roads Plan, with maintenance carried out by public service employees. This approach will create more opportunities for local contractors to compete for significant roadwork, the preferred approach by our government. Today, we are taking a similar disciplined and long-term approach to healthcare. Today, I want to confirm that we will not proceed with the healthcare campus-style facility at Kenmount Crossing that could cost the people of our province over $10 billion. With nearly $1 billion deficit we inherited from the Liberals, it is clear that this kind of facility is far beyond our ability to pay. They did not tell the people of the province that they had no plan and no budget to pay for a new hospital north of $10 billion. They also did not share that taxpayers previously owned it when they bought back the land at a price of more than $20 million. Better health care isn't built with $10 billion buildings. It comes from people in the buildings. It comes from recruiting and retaining more healthcare professionals to work within the buildings we have. If the choice is between shiny buildings versus strengthening our frontline healthcare workers, I will tell you where our government's priorities will always lie. When we do have to invest in infrastructure, we will spend smarter. That is why our government will begin planning for the redevelopment of the St. Clair's Hospital to address the needs of the population it serves. We will review options based on affordability and extending the life of this existing infrastructure. We will also refocus the proposed downtown health centre as a facility that will include much needed services that are not available at St. Clair's. As the original plans for the Janeway redevelopment were tied to the proposed acute care campus on Kenmount Road, we will be working with NLL Services to rescope this project to best meet the needs of the clients they serve. Today, we are pleased to announce we will initiate the planning of the new urgent care centre for Conception Bay South. It will provide same-day access to physicians, nurse practitioners, pharmacists, registered nurses, and other healthcare professionals to treat non-life-threatening conditions such as sprains, minor fractures, and infections. An urgent care centre in Conception Bay South will also reduce the need for residents to travel to St. John's area for conditions that require urgent medical attention. We will take the time to work collaboratively with the Health Authority to build a plan that will be supported by a budget. We'll also look forward to working collaboratively with the Newfoundland and Labrador Construction Association and the Heavy Civil Association on our priorities. Today, we are announcing that we will not be proceeding with the Sports Wellbeing Dome, which was tied to the proposed healthcare campus development at Kenmount Crossing. There are other, more responsible ways to encourage active, healthy living in our province. For instance, we will explore, in collaboration with municipalities and communities, ways to ensure that existing infrastructure is fully utilised. We will also not be proceeding with funding the proposed mid-sized theatre in St. John's. My message to the arts community is that we will always be open to other ways to support the sector that do not create the same kind of fiscal strain. These decisions were not easy. And we all like to have nice things. We all like building and buying nice things. But after 10 years of Liberals running up the province's credit card, it is up to us to get the province back on track. We are not in this alone and should not be in this alone. We will continue to work with the federal government counterparts to ensure that our province receives its fair share of infrastructure spending, and we work towards projects that are meaningful and necessary for our residents, and to make our own money go further. In fact, our Premier has written the federal government regarding our priorities for the $5 billion Health Infrastructure Fund. Before I conclude, I want to emphasise that there are many infrastructure projects that are currently under construction that will continue as planned. These include the replacement of our Majesty's Penitentiary, the redevelopment of the Emergency Department of Health Science Centre, school projects in Cartwright, Paradise, Pilly's Island, Portugal St. Philip's and St. John's. Municipal infrastructure work and the annual roads plan, which greatly impact many rural areas, will also proceed. We are reviewing our approach to both ensure we are getting the best value for provincial taxpayers. We are also working towards getting timely approvals on a number of projects that right now we can get shovels in the ground. We said we would prioritise people today while securing tomorrow, and that's exactly what we're doing. We are taking decisive action towards building a better, stronger Newfoundland and Labrador for all of us. Thank you.
Minister, can you walk us through the Kenmount Hospital, major project? Why not go ahead with that?
When I first got sworn in, one of the first briefings I had was on the infrastructure plan, and I seen a building that was in excess of 10 billion, and I'll say plus. There was no budget. There was no fiscal forecast. There was no money allotted. I think it was $25 or $30 million there. And my question is, how are we ever going to afford this? You have an $11 billion provincial budget, and you're building a healthcare facility that's going to be in excess of your provincial budget. So decision quickly rationalised in my mind, not sure the premiers in our cabinet, that this was not a feasible option.
There are a lot of known issues with St. Clair's Hospital. Staff complain about, the building not having what they need, and then issues of safety just in the area for both workers and patients going through. Do you think you can fix all those issues with this redevelopment?
Well, there's societal issues you're talking about the downtown core.
Some of it is, yes.
Right. But the building itself, it's probably 10 or 15 years older than the Health Science Centre. So, in actual fact, I think it's spending, as Minister of Finance states, spending money wisely. And I think we're going to be much better off to redevelop St. Clair's, make it, modernise it, and improve it. And like every building needs, renovation, I guess. And this in turn will provide a better healthcare to the people of the province.
I know you're still, looking at that plan. This is all very new, but do you have a timeline on how long that may take? Is this, 5, 10 years?
I'm not sure the timelines. We got to do the planning first and just figure out what's involved in that plan. So it'd be hard to forecast how long, but I would think well within that range. That would be our plan. Yes, absolutely.
It sounds like you're saying this project for the hospital was somewhat impossible to do. Why do you think the previous government committed to it, or was so sure that something like this could happen?
Probably a better question. That question may be best suited to ask the former premier, who made that announcement, and there was nothing. We could never find any information on any planning for a hospital, other than the fact that he went into the St. Clair's one day and announced a hospital. So, in full respect to that, I think the best person to answer that question would be former Premier Fury, because I was at a loss when I was sworn in. I'm sure our Premier views here would agree 100% that we both were totally dismayed that this building was proposed with $0 attached and an atrocious cost.
What can you say about the costs that have gone into it so far? I think we heard that about 3 billion of the 23, or 3 million of the 23 million has been used so far, and with the sports dome, it's somewhere around 5 million. What are you going to do to recoup these costs or to make up for those lost funds?
Well, some of it, unfortunately, maybe lost cost. I mean, if you're doing some, site preparation, whatnot. So, I mean, the land is still was in the departments in the province's possession. So I guess we'll decide that down the road. As further with the sports dome, again, that's a conversation we have to have. I know there's been money invested and there's some stuff purchased, but we will have future discussions about how we dispose of that. But our plan is that the province will recoup the majority of that money. Yes.
Urgent care center and the old Costco. You're building another one in Mount Pearl. And what we're hearing now is that they can't open the one in Mount Pearl because there's no staff. I know it's not your department, but how confident are you that you're going to be able to open up a new facility in CBS and be able to staff it?
It's a fair question, and we hear it, and as critic I used to ask that question too, but we're fully aware of that, and we're preparing for that, and we campaign on the promise of better health care. So we have plans in place, and I mean, again, Minister Evans and the department are working on that plan. So it's fair. I'm building the buildings, but we're working on a plan to address that as well. But it's a fair point, and it's something that was not lost on us. But we're not just going to build these buildings to keep them empty. We're building them to improve health care for the people of the province.
Do you think you're building them faster than you can staff them?
I don't think so. I think you look at Conception Bay South, it's my district, but it's something that I've been very vocal on over my term as an MHA, that we have no health services in the town that got 30,000 people and no public transit. People like to think we're metro. We're not metro. We have no public transit. So we're a rural community. My district is mostly rural. And I got people, if you don't have a family member to get you to the hospital, you're not getting to the hospital. So having them services in the community, it's been well received when we announced it during one of our commitments in the Blue Book. Our platform, I should say, was well received within the community, and I think it's a great announcement, and people I think will be pleased when it's open, up and running.
You mentioned that CBS is your district. 3 big projects were scrapped here today in St. John's, where your party doesn't have as strong of a presence as the other two. Do you think people might see that as a sign that you're maybe favoring outside of the city? Absolutely
not. The point you're missing, there was no budget with the things I cancelled. But there is a budget attached to redevelopment of St. Clair's. That's not going to be cheap. The downtown wellness centre, that's not going to be cheap. The redevelopment of Janeway, that's not cheap. Big dollars come with that, but we're going to actually put money with that instead of having a photo op and something on a piece of paper with $0. These will be projects that will be financed. We'll arrange it out in our fiscal forecast, and we'll work towards completion. Now, this stuff was never real. I guess that's the best way to describe it. It was never real. I mean, I can't be more frank. When you look on paper, there's no one. A lot of people other than me have looked at this. They were never real. They were announcements. They were on paper. That was where it stopped. So I have no doubt we will. It's nothing about that. I think St. John's, the area, are going to be well looked after. Comes to.
Do you have a sense of how much keeping St. Clair's open and extending the life of that facility is going to cost?
No, that's that's work we're going to do within the department. But I guarantee you one thing: it'll be a lot less than $10 billion plus to do that, a lot less so. And I think we'll get just as good or better outcomes than what we would get with this new centre in Kmart Crossing that we couldn't afford.
So you mentioned obviously the Premier's letter for the infrastructure fund, the health infrastructure fund, and I have it here and I've read it, and it mentions obviously the strain being felt in rural and remote regions of the province. So I'm just curious, are there any healthcare facilities in those parts of the province, in rural areas, that will be reassessed or reevaluated in any way to see how you can improve access for those people as well?
Yeah, well, one thing rural Newfoundland was a big part of the focus of our campaign. So any areas we can see to improve in rural Newfoundland, absolutely. I mean, there's a running list, no doubt, in health Department of Health has for they want needs, but that health infrastructure fund is very important. I think we can capitalize on monies from that. And I met during our early December with the Federal Minister of Infrastructures, provide FPT across the country, and that was an issue that was discussed then. It's something that we made clear that day, and Premiers followed up with that we want our share. We want what we're entitled to, I suppose. We've asked for per capita plus base plus per capita, which other smaller provinces look for, and our hope is that will happen. So that will go a long ways towards helping us with some of these urgent care centres as part of that funding too.
You've mentioned in the past that you felt that when say nursing graduates finish, that they should be given a job offer to stay in the province and to work, and Premier Wakeham has said the same. Is that something we can expect from your government when we see, graduations coming up in the spring?
Yeah, that's one of our commitments, and we're following through on our commitments. So absolutely, and I've spoken about it often, and the Premier has. Again, that's something that's working through, and I would think that would probably fall with Minister Dinh in education. But all these things are happening in some form or another. But none of our commitments are off the table. So that's a very important one with recruiting healthcare workers. So yeah, absolutely.
Your update today talks a lot about healthcare. You mentioned this mid-sized theater. What about new school construction and the ferry construction that you had promised during the campaign? Can you give an update on those projects?
Well, the new school construction is still ongoing. Paradise School is well on target. I think we're issuing tenders later this year. It's going to be the largest school project we ever in the province. Over 1,100 students, if I'm not mistaken. It's a big project. Kenmount Terrace is moving ahead. Cartwright School has some issues, but we're committed to completing that school. St. Philip's, Pushcombe St. Philip's, all of our school projects are well advanced, and some in the planning stage that was announced in last year's budget. That there's no schools off the books, so to speak. So we're moving forward, but we got to live within our budget too, and there's other needs obviously, but they may be addressed at a later time.
So no changes. Those schools that were in the planning stage.
No, but there's not right here today. So that could change next week, Patrick. But right now, today, no.
What about the commitment for the new ferries? We know that it's the RFP for the swing vessel, but is there any plan right now to get those other new ferries built here, as you said in the campaign?
Yeah, no, that commitment is still in place. We've talked about it in our department. What we're doing. I mean, really, you're developing an industry, right? It's just not so quick as to say you're going to build 3 ferries. We're trying to develop somewhat of a shipbuilding industry to the smaller ferries. And we're looking at locations, how this will look. So it's a where or what now. But I mean, you got to start from somewhere. You make that announcement. You just don't next day you're in the ferry business. But that was the commitment, and we'd start off with the 3 ferries. So we're working on that, yeah. And the RFP is closing on
February 19th.
February 19th. So, and we got interest there, so we're optimistic that we will actually get some good options from that. We've gotten good feedback from people that have reached out to us, so fingers crossed.
You're only a couple months out from the budget. How much of today's announcements do you think you're going to be able to incorporate into that? Or will some of that need a bit more time to kind of nail out the details?
I guess that might be a question Mr. Party might be able to better answer. I guess it'll all depend on what we perceive as necessary funding, for the first year. First year will be probably a planning stage studying. So I guess we can make some forecasts on that or operate within our current fiscal framework we got within the department. So we got a fairly substantial budget, so we may be able to find monies for this year anyway. Then we can get precisely where we're to in the actual dollars and cents.
A possibility that we might see some other infrastructure announcements not included today in the upcoming budget?
It's possible. Again, this is the high-level process of where we're to right now. We inherited a list of infrastructure projects, and we had our own idea of how to move forward with those plans. So again, I wouldn't be able to answer that question with clarity because anything can change. That could change within the day. Right now, I don't see it, but who knows?
You're very partisan, so how much satisfaction do you get out of the fact that you're ripping up all these Liberal legacy projects that are not under contract?
I don't think it feels good. It's disappointing, actually, as partisan as I may be, as you state. It's disappointing when you go in and you look at this so-called announcements, and some of them I wasn't totally opposed to. I questioned them, but they are what they are. And you see that they were just announcements. There was no budgets. There was no money attached. They were announcements, and that's what I've always been very partisan. I called out the former government for. It's not just about photo ops, and I was very clear on that. That was a common refrain for me in my days in opposition. It was about photo ops, and I've questioned it. And when I seen that list, that was exactly what come home to roost. That's what come home to roost. It was announcements. They were never funded. It was never real. So someone say I'm cutting the budget. I'm not cutting the budget because it's never in the budget. What I'm going to do now is. This will be real spending. We'll have budgeted monies for it, and people will be actually working, which is what we should be worried about, getting our own people on the ground, people construction and what have you, and spending money in the province, and in the end, improving our health care for people, for all of us.
On the dome, you have province has purchased for $5 million the stuff the materials to construct this dome. We're told that they are now being stored somewhere out by the on the CCH at Akita. What are you going to do with those materials?
I mean, that's a question officials are dealing with. I mean, because really that's under tourism. The dome, that money's come out of tourism. So there are some conversations going on, but they're not really to my level, if you know what I mean. Like, there are conversations. We are planning on repurposing that somewhere. I mean, you couldn't go ahead with a dome at Cameron Crossing. The dome was tied to the hospital. So, I mean, that's the whole idea when it was being pitched. The dome was with the hospital. The dome was not getting in on the Cameron Crossing up on the hill by itself, and it never really, and I mean, it really made no sense. That was the rationale beyond some of that, and we feel that we can repurpose other existing infrastructure to see the same outcome. So as for that dome, them conversation will happen in the next coming days and weeks, I guess, and we'll figure out. But we plan on getting it repurposed, yes.
To do what?
For its purpose. So someone else maybe wants a dome. But we don't plan on keeping that dome stored forever, and we plan on recouping our costs.
How would you describe the decisions that you announced here today? Was it an easy decision, difficult decision?
Yeah, I suppose part of you feels good because it's the right decision. You know, you feel strongly, and I think me along with the Premier and our cabinet, we all feel the same way. We feel it's the right thing to do. And I spoke to Minister Evans last evening, and there's a lot of effects her Department of Health. And we're all on the same page. We feel we're doing the right thing, and so those previous what we stopped, we never really stopped nothing. We just reset. We had a reset, and we feel that the direction we're heading in now is more realistic. And if anyone know me, I'm pretty frank and I'm pretty straightforward, and I don't. So what I'm telling you now is that's clearly as straightforward and as honest as I can be with you, and that's where we're to. And we feel strongly about what we've committed to and our promises, and with these bills, we're healthcare, and so that's about as clear as I can be.
Do you think the arts community will be upset with this announcement today, and do you plan on making it up to them?
What community, sorry?
The arts community?
No, actually, I don't think they're going to be too upset because there was no kickback from the arts community. There was no uptake from the arts community when this first came to be. I spoke out again on that issue too. Ironically, it seemed like speaking on a lot of issues, but when the theatre was announced, and I never got much blowback from people that were in support of the theatre. There was a couple. I mean, there was a select group, but very little. And as a matter of fact, I think there was more kickback of having that by other people in the community that were investing their own money into theatres. And there's a list of theatres. I got 6 wrote down that are in the city area that were doing fine. So I don't think it was any real upset, not whatsoever.
Some prime land on Cameron Crossing, 64 acres, I think. You going to find some use for that, or are you going to sell it?
It's a good question. I guess it could be sold. Depends on the price. We won't be selling it for cheaper than what we paid for it. I guarantee you that. But I have no idea. That's in our inventory. So who knows? I mean, that will depend on if it does. I guess we'll put it out to tender if need be. That's really what happens there. Yeah.
Can you just speak briefly about, I guess, your role in especially with the new hospital that's now been axed, just the process and I guess the growth of what was expected for the cost for that facility?
Well, I guess over time, the scope of these projects had changed from the initial announcements as we had talked about. And, our department works with the Health Authority and the Department of Health and Community Services on managing and delivering these larger scale projects. And so as a next step, we'll be forming a new steering committee to oversee the health infrastructure for Northeast Avalon, and we'll work with them to set our priorities and develop a plan for the government's consideration.
Thank you. Thank you.